Yeah, can I start? Hello, good afternoon, everyone. I'm Dr. Sachin Vilhekar. I'm a diabetic foot surgeon. I'm calling. We are from Raheja Hospital, Raheja Hospital, Fortis Associate, Mahim. Today, our awareness talk. We are going to talk on diabetic and foot care in diabetic patients. Diabetes. This is a okay. So today we are going to talk on diabetes and then the foot care. Why foot care matters in diabetes? See, diabetes is a metabolic disorder. Basically, it is associated with our lifestyle, hereditary uh, components are there. So diabetes is it's a basically it is a metabolic disorder which affects from head to toe. So there is a it is like a motherboard which associate with all medical conditions. In the diabetic patients, the main things are affected are peripheral neurovascular disease, cardiovascular disease. Also, it affects on renal disease as well as eye problems also. So basically, this all metabolic disorders. So in the foot care, we have to take care. Foot problems are very common in diabetic patient. So this is a mostly because of peripheral neurovascular disease, arterial disease. The patient lost their protective sensation, and then they land up in a major non-healing ulcers, gangrene, and ultimately they lose their limbs. So, as per the International Diabetic Federation in our India, nearly 89 million patients are already living with diabetes. Every year, this count is increasing. We are on second stage in the world for diabetic patients. First is China, second is in India. So this is the burden we have. This burden is a huge, extreme level of burden in our India. So basically, why we have to take care of our food? In food care, we have to educate our patient how to take care. We can this we can avoid amputations with basic food care. So first thing is that we ask our patient to take care of their feet, avoid them to tell them to encourage them to avoid barefoot walking, that need a special diabetic sandals which give us good protection to the foot. We have to tell him to how to inspect the foot on daily basis. Periodically they have to see experts to examine their foot and proper evaluation. Also, they need a proper blood circulation measurement. Also, every 6 months we have to ask or once in a year they should go the basic test that is called arterial color Doppler test, which we can measure the circulation to the foot. So these are the basic things we can tell them our patient. Usually, as per the ICMR, the data shows that every year almost 90,000 amputations are going only because of diabetes. So these amputations we can avoid. We can 80% of amputation we can avoid. This is all only with the basic foot care and examination. Diabetes basically is associated with a metabolic disorder. It is a it is a lifestyle disease. If you the, it is a very common in obesity. Every fourth person in India, every fourth person is in a high zone for diabetes, high risk zone for diabetes. So that is a things we can help them for to getting amputations and all these things. So today, this is a awareness program we are conducting on the uh, awareness in the society on the this is a tomorrow is the 14th November, in the International Diabetes Day. So we are doing this awareness program in the society how to prevent amputations. Yeah, we can ask any questions. If you have any questions, we can discuss the questions. Yeah, basic food care. Basic food care means what? The Because basic food care, this is all is required. Hello. Huh. See, now the question is, I have one question: how to know we have diabetic foot? See, the diabetic foot means what? Any foot infection which is happened in a patient who has diabetes. If any wound is not healing more than 3 weeks, that means it is a diabetic foot infection. So if any ulcer that is not healing lasts more than 3 weeks, uh, or there is a swelling, inflammation is there, redness is there, or is a discharge, that means it is a diabetic foot infection. To know that whether it we have affected is best better to show your expert who knows the who deal with the diabetic problems infection with proper, they can examine it and then we have diagnose it properly on the right time, and we can give a provide a proper treatment line of treatment for the to cure from this infection. Yeah, of course. If the sugar, there's a one question. The if of course, if the sugar level is high, the that means there's a metabolic problems. The burden of infection is also high because if the persistently sugar levels are remaining higher level in blood, so the patients are very high prone for infection because first of all thing because of continuous high level of glucose they are immunocompromised and they are more prone for any kind of infection. So of course we have to control your sugar levels for a consistent level. It helps for getting cure early cure from the infection. Sugar monitoring is necessary. In in food in footwear we can give them to proper option. Basically there are different how to choose a footwear right. So in footwear the footwear should be ideally footwear in diabetic patient that is a wide toe box footwear. It need a proper heel counter support as well as it has the outer sole supposed to be rigid outer sole and inner sole supposed to be a well padded uh, footbed insole which gives a protection and also it helps to distribute the equal pressure on the plantar surface. So that is also it's helpful for footwear. So that footwear has to be properly customized as per the patient foot. We can we have a special vendors. We ask them to give a proper foot impression, customize it properly as per that, so that deformity can correct, and it helps for a to avoid ulceration. Any question? तुम्हाला एंड करायचं असेल तर तुम्ही करू शकता किंवा पुढे बोलायचं असेल तर बोलू पण शकता. Okay. So basically, this our food is an important part. This food is made up with this is a highly developed complex structure. Every human the foot is made up with 26 bones and 33 joints. In diabetic, what happens? Why there is a recurrent ulcer in the recur because of patients walk barefoot and they wear some tight footwears that goes it causes the ulceration. And the patient law in diabetes, because of neuropathy, peripheral neuropathy, the patient lost their protective sensation, and they wear some tight footwear for and that can cause a shoe bite. Initial stage, because of lack of sensation, lack of pain, the patient does not put attention on the ulcers, and they keep walking on that same ulcer, and slowly gradually the infection spread more deep to the subcutaneous tissue, and then it reach into the bone joints. And then the patient come to know there is a ulcers or some is oozing, and then already delayed, and the patient land up in other amputations. If you wear a proper footwear and in periodical examination, so we can avoid all these things. So basically, food is an important part in our body. It helps to locomote movement. It helps to locomote ourselves. So better we take care of our food. Okay. So thank you very much for giving me this opportunity. This is a you can connect us on the SL Raheja Hospital. Thank you. I end my session. Thank you very much.